Welcome to the Ask Me Anything with Dr. Twyman. Tonight we ask you your questions about heart attack and stroke prevention. Hope you guys had a good Memorial Day. I've been doing a lot of hiking outside, so had a break from the Monday nights. So this is the makeup as usual. So if you're new, welcome. I'm a board certified cardiologist. My practice is Apollo Cardiology in St. Louis, Missouri, and I help patients reduce the risk of having heart attack and strokes. Used to be an invasive cardiologist taking care of people who were very sick, trying not to die in the cath lab, and thought that it might have been a better way to try to prevent some of those events instead of having those things happen in the middle of the night. So if you're looking not to show up to the hospital unexpectedly, that's what we try to teach you here. It's much more than just cholesterol. We'll, of course, answer those questions if you're interested in it, but you have to look at the whole picture. How healthy is the lining of your arteries, how much oxidative stress inflammation you have, and look at some lifestyle interventions more than just your diet and your exercise. What is your stress management? How well are you sleeping? Do you have good circadian biology habits? So we talk about those things. If you're looking for more and want to potentially work with me, my practice in St. Louis is still accepting new patients. My website is drtwyman.com. There's an application, and my team can talk to you if you're interested in potentially working with us to screen you up for your vascular disease or vascular risk factors. I also have a school community where at least monthly I'm doing AMAs. They're a little bit more in depth than what I can do on this platform. I'm also going to be doing some case reviews on the school community. Patients who are interested in me reviewing their labs and imaging and given permission will go through their information, and you can see how I think about vascular health. Again, more than just what your cholesterol is. And then the things that if you're interested in answering me questions on Instagram, every Monday morning, usually, today, Tuesday, I put a Q&A box in my story. Drop a question, we answer them in the order received. And those that join live, if they drop questions in the comments before we're done chatting, I'll try to answer those as well. So I think I might have talked about it last week, but I finally got everything up and running. I finally got a couple of my AI devices set up that can use an EKG. This was my EKG, which was normal, and they drop it in to this algorithm that then assesses what is your risk of having a low ejection fraction. In English, how well does your heart work? If you have a low ejection fraction, it can be due to blockages in the arteries, uncontrolled blood pressure, it can have a virus. There's many reasons why the heart might not pump well, but if your heart doesn't pump well, that is a high risk for early mortality. So this is trying to pick up people who are at higher risk. So fortunately, passed that test, very painless test. And then one that's I'm really excited about having is the CAD score test. We're the first, private practice in St. Louis to have it, and we may be the first private practice in, nearby kind of regions to have it. It's mostly based for hospitals and, patients showing up with chest pain. The CAD score is a device that essentially is a fancy stethoscope head that listens to the flow in your heart arteries and can assess, do you have a severe blockage in your heart arteries? This was something that used to require getting a CT scan or going to the cath lab to figure out. The test isn't perfect. It's mostly going to find people who are very severely stenosed or blocked, but it helps people who come into the hospital with chest pain. Is this likely the heart, or is there something else going on? So the CAD score and the Humana EKG, two AI-enabled devices that really help people understand what is the risk of heart disease. So with the housekeeping out of the way, we'll jump right into the questions. First question tonight, would I know if there are any foods that can help clean out plaque from the arteries? The short answer is once plaque's developed, there's not a lot of things that are going to quote, get rid of it. It's mostly about not doing further damage. The body has an innate ability to repair damage if you stop damaging the glycocalyx, which is the protective lining to the arteries. There's nearly 60,000 miles of blood vessels. They have a gel coat in them that's about the consistency of the white of your eyes or an egg white. If that coating is healthy, you tend not to develop plaque in the arteries. If that coating gets damaged from inflammation, oxidative stress, high blood pressure, heavy metals, plastics, take your pick of the over 400 things that can damage that layer. You then basically open up the door and allow inflammation to kind of take off in the glycocalyx underlying layers, and then plaque forms in the underlying intima and media. So they're not foods that per se are going to get the plaque out of the arteries. There's foods that can prevent some of the damage going forward, things that are high in antioxidants, berries and such. But think about it as trying not to do damage to the glycocalyx, and then the body can start to get to work at trying to repair the plaque. And this is kind of on the same kind of thread. Can the blood contain elements of cholesterol plaque? Short answer is, if I was being literal, yes. If a plaque ruptures, the oxidized cholesterol, the monocytes, macrophages, all that plaque spills out into the bloodstream, the blood clots, and that's what causes heart attacks. But if the person's not symptomatic, is there cholesterol plaque floating around in the blood? No, but there's things that could contribute to plaque. Lipoproteins, platelets, white blood cells, they're all floating around in the bloodstream, but they're usually not going to get access to underlying intima unless the glycocalyx gets damaged. And off to another topic. Somebody says for the echocardiogram, which is an ultrasound of the heart, if they're taking a medicine called telmisartan, which is a blood pressure medicine, should it be taken before the morning of the test? The short answer is you have to ask your doctors anytime you have a test, is there any special precautions for the test? Do you need to hold medicines? Do you need to be fasting? But for echocardiograms, you do not have to hold any particular type of medications. Telmisartan can help with blood pressure. They may be checking the echocardiogram to assess the left ventricular mass and wall thickness. That is a good indicator. If you have had blood pressure that's been high for long periods of time, the heart is a muscle and it's getting stiffer and thicker. Telmisartan is the treatment for that. So for the most part, yes, you should continue to take your normal medications, but always check with the doctor. If you're getting a test, is there any special precautions? And then, interesting, I actually got asked this question earlier today. Somebody says, Dr. Cruz thinks supplements are deuterated and should not be taken. Do I agree? Well, it always is going to depend. I never have a yes or no answer for many things. So, why are you on the supplement? What lifestyle thing could you not do on your own? Why are you taking the supplement? Is there a nutrient deficiency? Is there a genetic abnormality? Are supplements deuterated? According to Dr. Cruz, they are. Can you test for it? Not easily. Where else are you getting deuterium from? How much fruit are you eating? What type of water are you drinking? Are you drinking high elevation water, or are you drinking water that's more close to the sea, which is going to be heavier in deuterium? What kind of foods do you normally eat? Are you eating a seasonally appropriate diet? Do you have the ability to sweat, exercise, move your bowels, move your bladders, things that can help your body get rid of deuterium? So it's not that you're going to live a deuterium-free life, by avoiding supplements, but there are certain supplements that might be more problematic than others. But it's always about risk-benefit of anything you put into your system. So do I agree? Not necessarily, and this is something you got to talk about to your local doctors. If a supplement is recommended, what is the benefit? What is the risk? So this is, I think, just more as a comment per se, but I'll try to answer it. So statins and aspirins are a real must to manage a high score calcium and avoid heart attacks and strokes. There are tools that help. Aspirin prevents platelets from aggregating and clumping together. So I usually colloquially say, aspirin helps keep your blood like red wine, less like ketchup. Particularly patients with high calcium scores over 300, they're basically in the same risk category as somebody who's already had a heart attack. And aspirin in that population lowers the risk of them having a second heart attack. Statins are tools, they work. Not everybody can tolerate them, and most people don't tolerate them. It's usually due to muscle symptoms, muscle pain or weakness. So statins can help stabilize plaque. They don't always prevent the plaque from, building up if you're not fixing the other things. They don't reduce your plaque if you have significant insulin resistance, or have inflammation from rheumatoid arthritis, or you have sleep apnea that's untreated, or uncontrolled blood pressure. Statins are just tools to help lower lipoproteins, stabilize plaque, and lower inflammation. So they're part of the equation, but again, not everybody tolerates them, so use the tool to help lower their ApoB if you can't use the statin. And while we're waiting for any other comments to come in, I did see today that in the New England Journal of Medicine, there's a new candidate therapy for lipoprotein lowering that is not CRISPR. It's not breaking the DNA bases, or the double helix, I should say. It's just replacing a base pair, so it's more targeted. but it's working on the PCSK9 enzyme in the liver. They're using nanoparticles to deliver this technology to change the base pair in the DNA. They're using it for patients who have a genetic abnormality, familial hyperlipidemia, and have sky-high lipoproteins essentially since birth. So they're now in phase 2 trials. So they were able to show that with one treatment, the LDL cholesterol would be decreased for over 18 months with one treatment. It would be lowered by 62% over their previous baseline, which is a remarkable feat that's on par with PCSK9 inhibitors. So there may be a future technology for people who are very high risk, can't take medications for any reason, or from a compliance reason, it would be a lot easier to get a treatment once and never have to remember to take something to, quote, lower your cholesterol. So I always talk about like statins, the tools, they've been around for a long time. The safety profile is well known for them. If people choose not to take them for whatever reason, there's multiple other options. There's now another one coming online, hopefully in the next few years. All right. I'm not seeing any other questions coming out tonight. It may just be that, this was the makeup session. Not everybody knew that I was going to launch it off on Tuesday. We usually do these Monday, 6 p.m. Central Time. If there's a 3-day holiday, I'll usually do it the next Tuesday. But if you're ever looking for the archives of these and you missed it live, it's going to be on my Instagram feed for at least the next month. And I always take the old ones, drop them onto my YouTube channel, which is just drtwyman.tv. It forwards onto the YouTube handle. So if you're ever looking for the long form videos from before, that's the place to find them. So I hope you guys enjoy the rest of your week, and we'll see you next Monday, 6 p.m.